Vital signs interpretation is a fundamental aspect of healthcare that plays a crucial role in monitoring and identifying early warning signs of patient deterioration. Vital signs include parameters such as heart rate, blood pressure, respiratory rate, temperature, and oxygen saturation, which provide essential information about a patient's physiological status. Healthcare providers use these vital signs to assess the overall health of a patient and to detect early changes that could indicate a decline in condition. Identifying these signs early can lead to prompt intervention, reducing the risk of serious complications and improving patient outcomes. In this content, we will explore how vital signs are interpreted, the significance of each parameter, and how healthcare professionals can use them to identify early warning signs of deterioration. Heart rate, also known as pulse, is a critical measure of cardiovascular health. A normal resting heart rate for adults is typically between 60 and 100 beats per minute, BPM. Heart rate can be influenced by various factors, including activity level, stress, medication, and underlying medical conditions. An increased heart rate, known as tachycardia, can indicate several potential issues, such as fever, dehydration, blood loss, or a heart problem. On the other hand, a low heart rate, or bradycardia, may be seen in well-conditioned athletes, but it can also be a sign of heart block, electrolyte imbalances, or certain medications. Sudden changes in heart rate, especially when accompanied by other signs like dizziness, shortness of breath, or chest pain, should be promptly evaluated as they can indicate worsening cardiac function or systemic failure. Blood pressure is another critical vital sign, with a normal reading for an adult typically being around 120/80ths of a millimeter of mercury. Blood pressure is the force exerted by circulating blood against the walls of blood vessels, and it is influenced by cardiac output and vascular resistance. Elevated blood pressure, or hypertension, is a significant risk factor for cardiovascular diseases, including heart attack, stroke, and kidney damage. Hypertension is often asymptomatic, making regular monitoring essential. Low blood pressure, or hypotension, can occur due to dehydration, blood loss, or severe infection, and it can result in inadequate blood flow to vital organs, leading to shock. A sudden drop in blood pressure can be an early warning sign of sepsis, anaphylaxis, or internal bleeding. Changes in blood pressure, particularly if the values are outside of the normal range, warrant further investigation to prevent complications. Respiratory rate is a key indicator of respiratory and metabolic function. Normal respiratory rates for adults typically range from 12 to 16 breaths per minute. A rapid respiratory rate, or tachypnea, can indicate a variety of conditions, including fever, pneumonia, asthma exacerbation, or heart failure. Conversely, a slow respiratory rate, or bradypnea, can be a sign of respiratory depression, which can occur with opioid overdose, head injury, or other central nervous system issues. Abnormal respiratory patterns, such as Cheyne-Stokes breathing, periods of rapid breathing followed by periods of apnea, can also signal deterioration in the patient's condition. Monitoring respiratory rate, in conjunction with other vital signs, is essential for detecting early signs of respiratory distress or failure. Temperature is a vital sign that reflects the body's core temperature. A normal body temperature for an adult is typically around 36.5 degrees Celsius to 37 degrees Celsius, 97.7 degrees Fahrenheit to 98.6 degrees Fahrenheit. Temperature changes can provide valuable information about the body's response to illness or injury. A fever, defined as a temperature above 38 degrees Celsius, 100.4 degrees Fahrenheit, often indicates infection or inflammation. It can be seen in conditions such as bacterial or viral infections, as well as inflammatory disorders like rheumatoid arthritis. Conversely, a low body temperature, or hypothermia, can occur in situations such as prolonged exposure to cold, sepsis, or metabolic disturbances. A significant increase or decrease in body temperature should be investigated further, as it may point to an underlying infection or metabolic disorder that requires prompt medical attention. Oxygen saturation, or SpO2, is a measure of the percentage of oxygen bound to hemoglobin in the blood. A normal oxygen saturation level is typically between 95% and 100%. Low oxygen levels, known as hypoxemia, can be a sign of respiratory distress, cardiac conditions, or anemia. Conditions such as chronic obstructive pulmonary disease, COPD, asthma, or pneumonia can cause oxygen levels to drop. Oxygen saturation is particularly important to monitor in patients with respiratory conditions or those recovering from surgery, as changes in SpO2 can signal worsening of the underlying condition. Continuous monitoring of oxygen saturation, particularly with a pulse oximeter, allows healthcare providers to detect early signs of deterioration, such as respiratory failure or impending shock. When these vital signs are abnormal, they can indicate that a patient is deteriorating. Early recognition of these changes is crucial, as prompt intervention can prevent further complications and potentially save lives. One of the most commonly used systems for identifying early warning signs of patient deterioration is the Modified Early Warning Score (MEWS) system. MEWS is a tool that combines several vital signs, including heart rate, blood pressure, respiratory rate, temperature, and urine output, to provide a score that indicates the level of clinical risk. The higher the score, the greater the risk of deterioration, and the more urgent the need for intervention. The MEWS system helps healthcare providers prioritize care for patients who are at risk of deteriorating and guides them in making decisions about further testing, treatment, or escalation of care. The National Early Warning Score, NEWS, is another tool that is commonly used in hospitals to assess patients' vital signs and predict clinical deterioration. Similar to MEWS incorporates factors such as heart rate, blood pressure, respiratory rate, temperature, and oxygen saturation. The MEWS system also includes the level of consciousness, which is assessed using the APU scale: alert, verbal, pain, unresponsive. This addition makes MEWS particularly useful in detecting changes in a patient's neurological status, which can be a critical early indicator of deterioration. Both MEWS and NEWS are valuable tools for early detection, but it is essential that healthcare providers also use their clinical judgment and knowledge of the patient's condition when interpreting these scores. In addition to using early warning score systems, healthcare providers must be vigilant in recognizing other early warning signs of deterioration, such as changes in mental status, increased pain, decreased urine output, or the development of new symptoms like shortness of breath or confusion. These subtle changes can indicate a worsening of the patient's condition and may not be immediately obvious in vital sign measurements alone. For instance, a patient who is becoming increasingly confused or disoriented may be showing signs of hypoxia, sepsis, or metabolic imbalance. Similarly, a patient who suddenly experiences a marked increase in pain or a decrease in urine output may be at risk of complications like shock or acute kidney injury. In addition to monitoring the vital signs and using early warning score systems, healthcare providers must be aware of specific conditions that increase the risk of patient deterioration. These conditions may include chronic diseases like heart failure, COPD, or diabetes, as well as acute illnesses such as sepsis, stroke, or myocardial infarction. Patients who have undergone surgery or are recovering from a major illness are also at increased risk of deterioration and require close monitoring. Additionally, factors such as age, comorbidities, and medication use can all affect the patient's response to illness and the likelihood of deterioration. Early identification of patient deterioration is not only important for improving outcomes but also for preventing harm and reducing healthcare costs. When deterioration is recognized early, healthcare teams can implement interventions more quickly, potentially avoiding the need for more intensive treatments such as ICU admission, mechanical ventilation, or surgery. Furthermore, early intervention can help prevent prolonged hospital stays, reduce the risk of complications, and improve patient satisfaction. In conclusion, vital signs interpretation is an essential skill for healthcare providers in identifying early warning signs of deterioration. Heart rate, blood pressure, respiratory rate, temperature, and oxygen saturation provide valuable information about a patient's condition and can help healthcare professionals detect changes that may indicate a decline in health. By using tools like the Muse and News systems, as well as clinical judgment, healthcare providers can effectively monitor and manage patients at risk of deterioration. Early recognition and intervention are critical for preventing complications and improving patient outcomes, ultimately enhancing the quality of care in healthcare settings.